The following is a paid program paid for by My ROI Marketing Systems.
Hey, let me ask you a question. Have you ever noticed your feet or your hands start tingling, they're burning, or maybe they're going numb? Now, I'm not just talking about once in a while, but more often than not. Do you feel like maybe you're walking on pins and needles? Oh, maybe worse, it feels like you're wearing gloves or socks even when you're not. Now, according to doctors, these could all be signs that you're developing neuropathy. Now, doctors define neuropathy as a disease or dysfunction of one or more of the nerves that go out of control in your hands and feet. But what if I told you there's a potential solution? Now, one that requires no surgery and no downtime. Now, with this type of cutting-edge natural solution, imagine that you are once again able to live your life to the fullest. I mean, you can enjoy all those things that you thought were not possible, like maybe playing with your children, enjoying your grandchildren, taking a walk on the beach, maybe playing a round of golf, or just enjoying a good night's sleep. So let's get started by meeting my very first guest. Dr. Hartz, welcome. I'm so excited to have you on the show.
Thank you so much.
All right, tell me about your mission.
I am on a mission to help people across this country understand that there are now workable and effective solutions to treating the cause, not just the symptoms, of your neuropathy in a very safe fashion.
Because there's so much pain associated with neuropathy, isn't there?
The pain is tremendous, and it's different than most other pains. It actually has specific names associated that are associated with no other pains.
And so you tell me this is not something that you typically study in medical school?
Neuropathy is just cursorily mentioned in medical school. You know that it's there, you're told that there's virtually no treatment for it. That's basically what we end up. Now, I went to medical school a long time ago, but even students to this day don't learn about treatment of neuropathy, and pretty much everything you read or hear is that it's not a treatable condition, and so that symptoms are managed with medications.
So odds are if you're going near a typical doctor, they might not know all the treatments available.
They won't know any, really. Except for a very few specialists in neurology, rheumatology, the patient will be treated with opiates. They may be treated with a couple of other mood-altering medications that are controlled substances also. But the newer treatments, they know very little about. The usual patient will have seen multiple doctors before they arrive at a practice that understands neuropathy and its current treatment.
Tell me about your background.
I was very fortunate to go to college in the first place. Virtually no one in my poverty-ridden community in the Upper Peninsula of Michigan, no girls went to college. I was fortunate to go and be able to pay for it myself. There was no money to pay for college for a girl. Subsequently, I was accepted at Northwestern University Medical School and several others. I decided to stay in Chicago and have been very grateful for that decision ever since. And I started in pediatrics because that's what women did then. There were no women cardiac surgeons. There were very few women general surgeons. Matter of fact, even today, cardiothoracic surgery is a specialty that has the fewest number of women of any specialty on the planet. In any event, I finished my year of pediatric internship and was pretty aggressive, and I ended up wanting to do procedures and really taking care of the problem, very immediate gratification type of therapy. So I switched surgery, subsequently cardiac surgery, subsequently fellowship and this, that, and the other. And I practiced cardiothoracic surgery up to the level of professor with tenure of cardiac surgery and chairman at the University of Illinois.
Also board certified, also training doctors. I mean, your credentials are extraordinary.
Fortunately for me, I was referred to a huge pain practice. At a time in my life when I really wasn't sure what I wanted to do. I have to work. And I ended up working in this very large health and wellness clinic, learning things I'd never heard of in medical school. Then did the neuropathy training through this group.
So when a patient's experiencing tingling and they go to their doctor, what can they expect?
Generally, none of those physicians or practitioners will understand what neuropathy is and how to treat it. Therefore, the patient hopefully will be referred to a rheumatologist or neurologist, and even then, the diagnosis frequently is not completed. There are many causes of neuropathy. Some can be treated with surgery, such as that coming from your spine, radiculopathy. But what we're talking about today, the usual neuropathy of the peripheral nerves, that is not treated with surgery and is generally treated with very strong medications, and that's what will happen to the patient until they find a neuropathy specialist.
Now, I'm very excited. You left a very major career to focus on this. How do you feel about that?
It's amazing in many ways. I tried other specialties between cardiac surgery and non-drug pain management, and this one fit me. This is a way to provide care to the patients at very low cost, very effective treatment, very few side effects, and there are many, many, many forms of therapy that I'm so gratified that I've probably helped more patients in non-drug pain treatment than I did with cardiac surgery.
Wow. Dr. Hartz, has your involvement with neuropathy affected how you treat patients?
Not only has it dramatically involved the way I treat patients, but it has rekindled my passion for medicine, for science, for learning what is the correct thing to do, for writing papers. Every day is fantastic, and every day a new patient calls that heard about our program, and it's very gratifying.
What exactly is neuropathy? And I had always heard about it being associated with diabetes.
Neuropathy is damage to the nerves, and diabetes definitely causes damage to the nerves. A high glucose results in a low oxygen environment, the nerves become damaged. However, as opposed to the usual generally held opinion that diabetes is the most common cause of neuropathy, from my research and from my reviewing all the literature, diabetes is far from the most common cause. A very common cause of severe neuropathy, for example, is chemotherapy.
Oh, wow. So you've got cancer patients who are suffering with this as well.
Yes.
So anybody out there watching right now who is diabetic, going through any kind of cancer treatment, stands a chance of developing neuropathy?
That's absolutely correct. And pretty much with certain chemotherapeutic agents, the neuropathy is 100%. In other words, we should be developing preventive treatments for it.
So you're saying that the cause of neuropathy isn't necessarily the same for everybody. In fact, if I've got neck or back pain, that could have something to do with my neuropathy?
That's absolutely correct. There are so many different causes. The bottom line is that just like if we were deprived of oxygen in our lungs, we would die. That's what's happening at the level of the microcirculation and the nerves in neuropathy.
This actually sounds very logical and very promising for people who are suffering, but it makes me really question why people are just focused on the symptoms and not the cause.
That's exactly why I'm on this mission, to get the word out that there are alternatives that might finally make you not only feel better, but address the cause of your neuropathy so that you and other people will truly have a chance to heal. Just because your symptoms might improve doesn't mean you've eliminated the cause of the problem. It could come back with a vengeance.
So here's my big question. How come more people don't know about this?
The time has finally come where there's an emerging body of evidence, a critical mass of evidence, and a lot of science behind this evidence. But unless you're a doctor who's truly committed to finding the cause of the patient's neuropathy, how would you possibly know all this information? So what we've done is made it much easier for you to understand the causes and symptoms of neuropathy and its treatment so that everyone has the opportunity to benefit.
So how can we learn more?
Forbes, I would love to invite you and everyone watching who wants to feel better for a consultation. We will educate you about what your options are.
Coming up next is a very exciting technology that's actually covered by insurance and Medicare. We're going to meet Dr. Michael Johnson.
Are you one of the millions of Americans who suffer with pain associated with peripheral neuropathy? If you have pain anywhere in your body or you suffer with peripheral neuropathy, I have good news for you sufferers. You may think you've tried everything and been told there's nothing you can do. That's not true anymore. We are the only licensed clinic in the area that has the state-of-the-art Synexus machine. This machine can provide long-lasting anti-inflammatory effects on your nerves, your muscles, and improves your circulation. It is also FDA cleared. Enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf.
I actually would come in walking with a cane and go out feeling like I could kick my heels in the air.
This treatment is covered by most insurances, including Medicare. Call the number on your screen for a free consultation and start living life once again.
So we've been talking to Dr. Hartz about neuropathy and the symptoms and the pain associated with that, I've got another great guest I want you to hear from. His name is Dr. Michael Johnson. He is the CEO of Apple Medical Clinics. I want to welcome you to the show. Now, you have a very interesting background. Tell me about it.
Well, I've been in private practice in Appleton, Wisconsin since 1983.
Okay.
So I've been around the block a little bit. In 1997, I started in the neurology program with the Carrick Institute.
Okay.
So now I'm a board-certified chiropractic neurologist. I've written 7 books. And as mentioned, I've been treating and helping patients for the past 37 years.
We should also add you're also a patient yourself.
That is true. I suffer with MS, and as a result of my MS, I have peripheral neuropathy. I have severe pain and numbness from my knees down to my toes.
So that's sort of set you on a very personal quest, I'm sure.
Yes, because of the fact that nothing out there was helping me. And I went from one treatment to another, to a third, to a fifth, to a 20th. I'm kind of like the patient who's been to 15 to 20 doctors and nothing's working.
So you mentioned that you're a specialist in neurology.
Correct.
Explain what that is.
Neurology is the study of the brain and the nerves and how the brain and nerves communicate with one another.
Okay, so then neuropathy is?
Neuropathy is the pain and numbness that is associated with the symptoms in the arms, hands, legs, and feet.
What are the early warning signs that maybe you should go get tested?
Well, it really comes down to pain and numbness. So if you have any type of pain and numbness in your hands, your feet, your legs, your arms, you need to get checked. The problem, as we've mentioned before, the only answer medicine has is a medication. And usually the medications, at the very best, relieve a little bit of the symptoms, but they don't correct the cause.
And you've been teaching doctors all about neurology, yes?
Since 2006, I've been teaching doctors throughout the country, not only functional neurology, how to help patients by doing specific brain-based exercises, but also how to successfully address peripheral neuropathy.
Are you one of the millions of Americans who suffer with pain associated with peripheral neuropathy? If you have pain anywhere in your body, or you suffer with peripheral neuropathy, I have good news for you sufferers. You may think you've tried everything and been told there's nothing you can do. That's not true anymore. We are the only licensed clinic in the area that has the state-of-the-art Synexus machine. This machine can provide long-lasting anti-inflammatory effects on your nerves, your muscles, and improves your circulation. It is also FDA cleared. Enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf.
I actually would come in walking with a cane and go out feeling like I could kick my heels in the air.
This treatment is covered by most insurances, including Medicare. Call the number on your screen for a free consultation and start living life once again.
Somebody's going through cancer treatment. They know they're going to be going through this. Might they start something soon?
Many oncologists are not telling their patients, look, there's a good chance, a very likely chance, you're going to develop peripheral neuropathy with this. They just leave it as a crapshoot. And when the patient comes back to them and says, why didn't you tell me? Well, some people get it, some people don't. That's their answer.
We have a lot of people watching this show who are suffering from pain and tingling and numbness. If in fact it is neuropathy, is there something they can do to alleviate their pain?
There is something, finally, and it took me forever to find it, but through my pain and suffering, I finally found something that worked. It's called Synexus.
Okay, what is that?
Synexus is electric cell signaling, which delivers energy to the affected areas by varying wavelengths. It's high, medium, and low frequency using amplitude and frequency modulation. Now, what does that mean?
Right.
Big fancy term. And all it means is Synexus uses the entire spectrum to help your body to regenerate and recuperate and heal itself.
Okay, I'm looking at a machine whose name is Synexus. Is that what we're talking about?
Correct.
Okay, can you explain what this is?
Sure. Again, it's basically electric cell signaling. These electrodes are placed on the body. There is an electrolyte solution that is used. There are sponges that are used in the electrodes. This is a vasopneumatic component. So Synexus not only helps heal the nerve, but it also helps increase circulation. So you remember cupping with the Olympics?
Sure.
And the guy on his back had all those marks? Right. Well, Synexus does something very similar. But it also, in addition, will heal that nerve because of that electric cell signaling. It helps the cells communicate with one another. So that's the key in healing, is allowing your body, well, actually it supports your body to allow for maximum healing.
So help me out with this. We've uncovered a lot of different modalities for alleviating the pain associated with neuropathy, but it seems that a lot of doctors just don't know about them.
Well, they don't, because again, only medicine knows drugs and surgery, and there's no surgical answer for peripheral neuropathy.
Right.
So they use medications, and those medications have serious side effects.
We got that, but I don't know that we've known that there's ways to make yourself feel better. I mean, I'm so excited about this show, I can't tell you.
Well, it's an all-natural therapy. That's the beautiful thing about it. There aren't any side effects. We do use a vitamin blend injection, especially with neuropathy, that we inject under the skin. They're B vitamins, vitamin C, alpha-lipoic acid. It's compounded in the doctor's office. So we, along with the vitamin blend injections, we utilize the cell signaling equipment with Synexus, and that's what helps heal the nerve and increase circulation.
Well, you're also a patient, so how well does it work?
The first time I had Synexus placed on my legs, I noticed an immediate change. The second time, I said, this is going in our office. We have 10 of these units in our office. They're humming all day long, meaning patients are on and off them all day. It's a 30-minute treatment time. We see the patient twice a week for 12 weeks. At the end of that time, we re-examine them.
You know, my mom was a diabetic, and she had neuropathy, and I remember her just crying all the time, and it's interesting to think that there's actually something that can help. So I'm going to look at you right now and say, look, if you are suffering with pain from neuropathy, I know it's very real. For a long time, her doctor said it was in her head, and I watched how she suffered, and I don't think I truly understood the level of pain that she had at the end of her fingers and all the way from her knees down. There are options, and I'll tell you what, they're being made available through this show. Here's what you need to do. You need to look at the number on your screen or the website, reach out to a doctor near you, and find out how you too can stop suffering.
Are you one of the millions of Americans who suffer with pain associated with peripheral neuropathy? If you have pain anywhere in your body or you suffer with peripheral neuropathy, I have good news for you sufferers. You may think you've tried everything and been told there's nothing you can do. That's not true anymore. We are the only licensed clinic in the area that has the state-of-the-art Synexus machine. This machine can provide long-lasting anti-inflammatory effects on your nerves, your muscles, and improves your circulation. It is also FDA cleared. Enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf.
This is the only thing I found that's actually given me some hope.
This treatment is covered by most insurances, including Medicare. Call the number on your screen for a free consultation and start living life once again.
I've just gone to a regular doctor, but because there is no cure, nobody knows what to do. I don't want to take drugs. I've had steroid shots. There again, it's drugs. I don't want that. It's not curing anything. I heard about the Synexus machine and found a place where I could have the treatments. I've had the treatments, and within the first and second time I've had them, I can notice a total difference. I can do a whole lot more. I have a lot more energy. I just feel all around better. I was able to bake and cook, things I was not being able to do because I couldn't stand for very long. The Synexus made a big difference.
So I'm just in awe of the fact that you have a machine like this that couldn't potentially help.
Well, it actually works.
Right.
Remember, I tried many other units and different modalities to try and really relieve my peripheral neuropathy.
Right.
This is the only one that I've found that's helped me, and now it's helping hundreds of patients.
So we've got people watching the show who have tried everything, spent so much money. I am looking at this machine, I'm thinking, okay, this is going to cost. It's pretty big, heavy duty. What can a patient expect to pay for this?
So the beautiful thing, Forbes, is this unit, Synexus, is covered by insurance and it's covered by Medicare. How that happens is we have medical doctors, nurse practitioners, RNs, and LPNs directing all of the care. So it's of little to no cost to the patient depending on their insurance.
So if somebody's suffering right now, they need to run, literally run, not walk.
Well, as a patient myself, I tried everything to help my peripheral neuropathy, and nothing worked until I got on the Synexus unit. And after the first visit, I noticed a change. It was the first time in almost 10 years that I noticed a change in my peripheral neuropathy.
I was in a lot of pain. After my bus run in the morning, I was 2 hours in bed. I had sciatica 24/7. Getting dressed in the morning, I leaned on the wall to get my underclothes on, lean on the wall to get my pants on, and my pain level was so out of control. After I came here, it's healed all those nerve endings. I don't have the sciatica anymore. And I was to 2 spine doctors, and all they wanted to do was surgery. And I was scared of it. It's so nice. It's so nice to be able to start walking again. I wasn't able to do that. You're my hero. You never gave up on me, and I can't thank you enough.
We initially see patients with 0 to 5 small nerve fibers per millimeter. By the time we're done with 24 visits, we're looking at anywhere from 20 to 40 small nerve fibers. So it's a significant increase. So that is a permanent correction.
So you're starting to feel this. What should you do first?
You should get checked immediately. See your doctor. Have them do a test. There are several tests that they can do. A nerve conduction velocity test called an NCV, an EMG, which measures the electrical current coming down through the nerves. So those tests are going to tell you whether you have peripheral neuropathy or not. The small fiber density test will tell you if you have peripheral neuropathy. So get tested early.
So now I got to ask you, if you suffer from tingling or burning or numbness in your hands and feet, there are so many options that you may not have been aware of before this show.
Are you one of the millions of Americans who suffer with pain associated with peripheral neuropathy? If you have pain anywhere in your body, or you suffer with peripheral neuropathy, I have good news for you sufferers. You may think you've tried everything and been told there's nothing you can do. That's not true anymore. We are the only licensed clinic in the area that has the state-of-the-art Synexus machine. This machine can provide long-lasting anti-inflammatory effects on your nerves, your muscles, and improves your circulation. It is also FDA cleared. Enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf.
I've had the treatments, and within the first and second time I've had them, I can notice a total difference.
This treatment is covered by most insurances, including Medicare. Call the number on your screen for a free consultation and start living life once again.
My feet were hurting to the point where I didn't want to wear shoes nor socks, and they were also felt cold quite often. So when I heard about this Synexus treatment from a friend, I decided that might be the thing to try. And I can say that I actually would come in walking with a cane and go out feeling like I could kick my heels in the air.
But you also have a very personal story you want to tell me about.
I have so many, but one particular man, very young, with a severe autoimmune peripheral neuropathy, has been to all the major medical centers in Chicago, has had the highest level of neurologic testing, and unrepenting, unremitting neuropathy, helped really only by our therapy. This man has outlived the life expectancy of his known condition in a reasonable fashion. He can walk. When the weather's particularly good, he actually has a wonderful day. I can never get him out of my mind. I think about him almost every day.
Because prior to this, he had no hope.
No hope. He was in such intense pain and also had severe stresses in his family that worsened the condition. And he is particularly delighted now because spring is coming. He'll have hopefully a lot more good time.
So someone listening to that story right now who says, I've tried everything, what are you going to tell them?
I am begging you, if you have any of the symptoms we've discussed today, to seek medical attention now for 2 reasons. Neuropathy is a progressive condition. It will not get better on its own. It will not get better with the medications you are taking to treat the symptoms. Secondly, the longer this condition goes untreated, the greater the nerve damage and the harder it becomes to treat the cause and the symptoms of the disease.
If somebody that you know is suffering from pain, numbness, tingling, you need to take action right now. There's a number on your screen, and there are solutions available that perhaps your doctor never thought to tell you about. Your health is your responsibility. Please do it for us and people that you love. Don't wait.
Are you one of the millions of Americans who suffer with pain associated with peripheral neuropathy? If you have pain anywhere in your body, or you suffer with peripheral neuropathy, I have good news for you sufferers. You may think you've tried everything and been told there's nothing you can do. That's not true anymore. We are the only licensed clinic in the area that has the state-of-the-art Synexus machine. This machine can provide long-lasting anti-inflammatory effects on your nerves, your muscles, and improves your circulation. It is also FDA cleared. Enjoy all those things you thought were not possible. Imagine playing with your grandchildren, taking a walk on the beach, or even playing a round of golf.
My horse's name is Buck, and now because I ride more, he probably doesn't like that.
This treatment is covered by most insurances, including Medicare. Call the number on your screen for a free consultation and start living life once again.
Dr. Hartz, we have a person who's very, very dear to both of us who suffered from neuropathy and did not listen to your advice. What happened?
Yes, this patient initially did follow the treatment protocol, but it didn't last long. And he lapsed into his old lifestyle. He's a diabetic. And eventually, his neuropathy progressed to the point where he required amputation of his leg. During the few years that I interacted with this patient friend, I begged him to use the methods. I even offered to deliver them myself. I recommended various diets. But like we've said today, don't procrastinate. Act now.
So Dr. Hartz, right now we're going to hear an amazing testimonial.
So when I first came, I had like a pain 9 or 10. It was hard, excruciating pain, you know, when it would hit me. So now, since I've been doing the treatments, I don't have that shooting pain anymore. I can get in and out of my car without pain, and I can work longer. I ride my horse a lot longer without pain. So it's really been a benefit to me to have the treatment here to eliminate the pain.
Dr. Hartz, I want to thank you for the education, for the knowledge, and for the help that you're doing for so many people. You know, I've been doing this a very long time, and I'm going to say that this may be the most important broadcast I've ever been a part of. Thank you.
Thank you so much for the compliment and having me. And for you out there, please, please, I hope you can hear the passion in my voice. If you or one of your loved ones has any of the symptoms we've discussed today, please seek attention.
So here's what we're asking you to do. Simply come for a consultation. If you're suffering from pain, numbness, tingling, or having trouble with balance or walking, tell us your story. Learn from our neuropathy team whether you're a good candidate, and then you get to decide for yourself. So if you or somebody you love is still suffering, you don't want to miss out on this opportunity.
Are you one of the millions of Americans who suffer with pain associated with peripheral neuropathy? You may think you've tried everything and been told there's nothing you can do. That's not true anymore. This machine can provide long-lasting anti-inflammatory effects on your nerves, your muscles, and improves your circulation. It is also FDA cleared. This treatment is covered by most insurances, including Medicare. Call the number on your screen for a free consultation. The proceeding was a paid program paid for by My ROI Marketing Systems.